I want to say thank you for coming out on Sunday morning. We wanted to take a second and talk a little bit more about public safety in Jersey City. We've had a lot of questions about status of officers and service calls and overall safety, and we thought it would be helpful for residents to understand a little bit better of what we're seeing on the ground here in Jersey City. And residents should know that we do have a fully staffed police department. I'll go through some numbers around that shortly. We are seeing a decrease in calls of service, which is great, about 25%, and major incidents are down, so we're thankful for residents around that. And we are seeing a change in manpower and deployment strategies, which the chief and the director will talk about a little bit more specific. It is accurate, we have 2 officers that are both at the medical center in serious condition. We have 8 officers that are quarantined, medically advised, and we have 8 additional ones that are quarantined because of working in close proximity to those officers. So a total of 16 officers that are in quarantine. We currently have 42 officers that are out with symptoms, and we have 24 officers that have been out that have returned to service. So there's no question that we are seeing an impact on first responders, and I just want to highlight how appreciative we are that they are out there every single day. We are working with some of the corporate community down here in Jersey City, and our OEM director will speak shortly about what we're doing to make sure that those officers are safe. We've changed procedures, as I touched on earlier. How many officers are in a car, when they deploy, what they're doing, how we do roll call in the morning. All of that has changed in the last several days. We have started doing deep cleaning of all of the police precincts, and we have changed our cleaning routines as well. So this obviously impacts all parts of life in a city, and public safety and the first responders and our police department and fire department is no different. And I'm going to turn it over to our public safety director to give some additional color, Director James Shea.
Good morning. The first thing I'd like to reiterate is the mayor's point that public safety posture in Jersey City is completely unchanged since the beginning of this pandemic. Our police department is answering every radio run and patrolling with the same numbers and the same manpower as before. Our fire department is answering every call. As a matter of fact, our fire department handled 2 major water main breaks, which are challenging at the best of times last week in the middle of this pandemic crisis. Some changes we have made, though, none of them affect the response to citizens, and none of them affect anybody's safety. They affect our ability to keep our officers working and to keep our officers and firefighters as safe as possible. So we have ended face-to-face reliefs, where officers speak to each other before they go onto the new shift, or where firefighters come in and speak to each other. That's now done via cell phone and telecommunicating. Our officers are arriving on staggered times. Instead of all coming in at the same time, we're trying to have them come in at 10-minute intervals so that there's less face-to-face contact. There is no more roll calls, as the mayor mentioned. The sergeants and lieutenants are doing training and giving necessary information, again, either via cell phones or over the radio. We've broken 2-man cars, or we're in the process of breaking 2-man cars and into 2 cars. So instead of 2 officers being in a car together, 2 officers will be in 2 cars convoying to minimize face-to-face contact. None of this is because we have a crisis. It's because our police and our firefighters are our front line against whatever we have to face in this pandemic, and we're just taking every step we can to ensure that we have as many of them available as possible, come what may. And we think the early steps we took are going to pay dividends as we move forward.
Okay. I'd like to turn it over to Chief Kelly, who's direct contact with all of our 950 police officers. Chief Kelly.
So good morning, everyone. I think one of the most important things to know is our police officers are no strangers to stressful situations. And of course, the pandemic is putting stress on all services, not just police. However, these men and women they're brave beyond their years, and we trust them with our safety. So I think that the important thing to look at is, although we have 42 police officers that are out sick, showing symptoms, flu-like symptoms, we actually have 24 that returned to duty since March 1st. So it's allergy season, it's cold season, it's all that other thing. And when our police officers know that they're ready to return to work, they get back to protecting and serving the city. So I'm really proud of them for that, and we'll continue to monitor that particular thing. The other thing is we take very serious the work environment that the police officers are put in. They cannot practice social distance under all circumstances. So we want to make sure that their facilities are clean. Every single day they go through a regular cleaning in their facilities and their cars, twice weekly. 2 times a week they get a deep cleaning in their precincts, and on demand they get an aerosol cleaning, which is what the East District just went through behind me, which means we vacate the premise and it gets a total aerosol cleaning. So the mayor has made it very, very clear that our first responders, especially our police officers, will have the best in terms of making sure that our environment is as clean as it can be. The other thing I want to talk about is we are very, very fortunate in the police department. We have PPE kits that have been staffed by our OEM director, Greg Kearse, mainly from day one. We've had the N95 masks from day one. We have overalls, we have gloves, and we have sanitizer. So we're very, very happy for our OEM, local OEM director Kearse and his staff for providing that. Also, we work very, very closely with Director Flanagan, Stacy Flanagan from Health, and we constantly are on the phone with her when we have a police officer with symptoms, and we get guidance directly from the epidemiologist and the doctors that work on her staff. So I think we're very, very fortunate in Jersey City to have all these things. As the public safety director alluded to, we've canceled all roll calls, and we've also flagged locations where we think in the city police officers may experience exposure problems. They've been flagged in terms of calls for service to any of those locations. We also are going through a call screening process so that if there is any sickness at any call for service, we want our police officers to know, and so that they can don the gear that they need to. On Monday at 0800, we'll start a telephone reporting unit for minor incidents and minor crimes. The most important thing to know about that is the mayor was very, very concerned that when a citizen wants a police car, no matter what the incident, they're going to get a police car. So although we're going to go to a telephone reporting unit for minor issues, if a citizen wants us, we'll be there just like we would any other day. So we're very, very happy to say that our police on the front line are continue to do the job. Thank you.
To give you a little perspective on what we're seeing in the fire department, we have Chief Stephen Gill here.
Good morning. Really, the fire department hasn't had that much of an adverse effect. We've only had 3 people who are self-quarantined. None of them showing symptoms or signs of anything, and they'll probably be back to work next week. Other than that, the sick leave has been pretty good. Not too many people calling in except for the last 2 days, but it's a weekend, so that's expected. So, but other than that, honestly, nothing really has changed much in the fire department. We have changed a couple of procedures, just how we do shift changes. And social distancing is very difficult in the firehouse because you have so many people living together in an area for 24 hours. So we're doing our best to do some internal social distancing as best as we can. So far we've been pretty good. Oh yeah, I mean, one of the other things is just the social distancing part of it. We've canceled all school drills. We've canceled all visits to firehouses. We usually have schools coming by and that type of thing. So the firehouses pretty much are closed to the public and just for our own members. Even off-duty members are told not to come to the firehouses unless they have to change for pick up equipment if they're working somewhere else in another station. But other than that, everything is pretty much normal right now.
So before I open up to questions, I'll just say that we've budgeted that this will cost us, if this prolongs, about $750,000 to $1 million a week. So public safety is our #1 priority. We are putting plans in place to make sure that if this goes for a prolonged period of time, that we do have resources allocated for that. So all of our directors have started to amend their budgets in order to take into account what we expect to be a long, drawn-out process. So with that, if there's any questions on public safety, we're happy to address them.
Mayor, there was a concern raised by a couple of officers saying that they were getting some sanitation things like sanitizer, like the masks that were expired or damaged. I was wondering if that was a legitimate concern.
Yeah, I believe that's a national issue. When this happened, no one worldwide was ready for a worldwide pandemic. We issued what we had immediately, and we obtained replacements as fast as possible. Important to note, No one with expiration dates, like the masks, the expiration date is really for the rubber band holding the mask. We did our research. We made sure that everything we gave out still had the same effectiveness as when it was issued.
Anything else?
Yeah, any police officer who has tested positive has undergone the same contact tracing that anybody else who tests positive comes into. And no, we're not aware of any contact resulting from a police officer to a citizen. But anybody in the city who tests positive undergoes a complete contact tracing regimen by the Department of Health, and anyone in contact with them is notified.
Number of COVID patients in Jersey City still sitting at 50.
Hey, Stacy, you want to speak to?
So we get updates in our communicable disease reporting and surveillance system every several hours. So at this current time, we have 53 COVID positive. And then all of the individuals that may work for the city but do not live in the city, we are also contact tracing with them.
Okay, thank you very much. Have a great day. Thanks.
Thank you.